there's a PDF that is in that file.
Okay.
So the good news about what we heard from Stetson is that it aligns very much with some of the work that we already had planned. And so it really was nice to hear just a reinforcement of the ideas of things that that we had already determined were areas that we wanted to address. And so I was really excited to see those pieces. Let me see if I can share this with Lisa right fast. So when we looked at what we heard from Stetson, and we looked at the new monitoring systems, because as Dr. Walker mentioned, there are 2 accountability systems for special education. The state has been kind enough to change them and rename them both this school year. So they've expanded the information that we have to look at this school year, gone a little bit more in depth. In years past, we've had the opportunity to look at our programming, analyze our data, and then respond only if there were some areas of need. Starting this year, every district in the state will complete a district program assessment, a special education department assessment. Every district in the state will submit that to the state, to TEA, and we have to submit evidence of our rankings of our programs as well. So it really is a good opportunity in that it lets us look at Tier 1 instruction and general education programming, as well as special education programming, as well as the RTI process, response to intervention, to see how all of those things filter together. So that system in itself leads to strategic planning, which is one of the things that we've looked at as well. Did it come through, Lisa? Yes. Okay. So I have 5 things on the list for our plan of what we'd like to do moving forward, and these are not in any particular order, but this is the order in which we discussed them today with the stakeholders who were in our meetings. The first one is a vertical alignment of special education program planning and implementation. And so within that, we want to look at our instructional models at each campus and make sure that if you're in a co-teach model at the primary school, the same systems and supports are in place for you as there would be at the intermediate school, the junior high, the high school. So what does our autism instructional programming look like? What do our resource type programs look like? And make sure that we have the same systems in place district-wide. We are required to provide a full continuum of services at every campus if our student needs determine that we have that level of need there. So we may not have a co-teach at one campus for this school year because we don't have students who require that level of support, but we have to be prepared to offer the full continuum of services. We want to make sure that everyone understands what that continuum looks like. Additionally, we'd like to expand the capacity of our experts in instructional models. We have some really amazing teachers in ISD, and we have some teachers that Stetson identified as presenting some model practices. We want to build the capacity of those teachers so that they can support their peers. It's one thing for Rosanna or I to come in, watch a classroom, talk with the teacher, and give some suggestions about what they might try differently, especially if they feel like they've tried everything. When they're talking with a peer who's in the trenches in the same instructional model as they are, and they're getting that support and guidance from that peer, it's a little easier to digest and believe that it might possibly work to try a little bit differently because they're walking in the same shoes every day. We want to build that capacity, and we've got some amazing folks that can support each other. And the third thing under that item is to increase an understanding of instructional models so that when we go into an IEP team meeting and we're making recommendations about what should be involved in that student's IEP, we understand that this is the model that serves a student with this level of needs. We're still on number 2, Lisa. I mean, on number 1, Lisa, I'm sorry. So making sure that everyone understands in a discussion what that student's needs lead us to in terms of an instructional model, and that we're all talking the same language. The second item there is strategic planning for special education. It's really exciting that this lines up at the same time that we're doing strategic planning for the district as a whole. and we start to look at the new monitoring systems for TEA, we've got to do certain self-assessments. We've got to focus on identification of students, implementation, and family engagement. So if we've got to do those things to meet the requirements of the state, those are the 3 things that we need to be focusing on in strategic planning for our department as a whole within Livonia ISD. So TEA actually has some employees now, they're TEA liaisons, that work in the region service centers. We have 2 TEA liaisons in Region 20. They will be coming out to our district, working with our stakeholders to build on what Stetson's already done. So we did these Stetson meetings at the very end of the school year last year with some fairly small groups of people. We want to expand the number of stakeholders who have the opportunity to give us input, because we can pull all of the quantitative data in the world out of our computer systems. It's that qualitative data that we need more of. Because as Dr. Walker mentioned, your perspective is your reality, and we want to make sure that we're all clear, even if we don't like what's going on, that we understand the context of why we're doing those things. So we want to expand that, and then the TEA monitoring system requires a multidisciplinary approach to building your strategic plan, meaning you have general education teachers, special education teachers, parents, community members, business leaders, students, and we want to do that same thing in building our strategic plan so that it's all aligned. And the TEA liaisons from Region 20 will help to do that for us, and they do that for us at no cost as well. The 3rd thing on the list is professional development, and this is for campus and instructional leaders across the district, general education and special education. A lot of times when we're looking at what we have to do or need to do at the start of the year, we kind of portion things out, and it's hit or miss with certain groups. But what I think Dr. Walker was able to clearly explain was that we need consistency, and we need it every year, and it needs to be ongoing. And so we've got to make sure that we're looking at our PD plans in terms of what support is needed continuously throughout the year, and making sure that everyone's getting that information. One of those things that are bulleted there would be the implementation of Tier 1 behavior and social skills models, making sure that we have consistency in our behavior expectations for all students, and that we're teaching school-based behaviors at school. One of the parents asked today, how do you make sure that the social skills you're teaching don't conflict with the social skills or acceptable behaviors from the home? And what I explained to him was that we're talking about showing respect for others, showing respect for the opinions of others, and how to appropriately respond when we're offended by something. Teaching students how to do school, because a lot of times they're coming to us and they don't know how to do that yet. And so we need to make sure that we're providing that instruction for them. One of the things in the new TEA monitoring system for special education specifically asks that the district has general education consistency in behavioral supports and expectations. And so the TEA special ed system is asking about what general education is doing. And so we have to make sure that we're implementing those systems. We also want to make sure that everyone understands what specially designed instruction is. Just because you have a disability does not mean that you meet eligibility requirements for special education. In order to meet those eligibility requirements, you have to have a disability and an educational need. Educational need means that you have a need or requirement for specially designed instruction. But what are we doing differently? Because we can label a student as having a disability, but that really doesn't change anything unless we change what we're doing. And so we have to be able to talk about what is different about this child's plan now that we've identified their areas of need. We also want to make sure that everyone understands what our models are for inclusive education, how a student meets the criteria for that level of support, and we want to make sure that our co-teaching partnerships are effective, meaning they're planning together, they have shared ownership in the classroom, shared responsibility in teaching, and that those partnerships are consistent from year to year, and that we don't have one inclusion teacher that's responsible for co-teaching in English, math, and science, that we're trying to streamline that and keep their responsibilities focused to one content area as much as possible. The 4th thing on our list was integrated planning to meet the needs of all learners. And so we've already begun our work with professional learning communities and making sure that we have collaboration time within the school day for all of our teachers to work together. We want to make sure that our special education teachers are an active part of that planning and collaboration. And the second piece is universal design for learning, which comes actually from the world of architecture. It's easier to plan for the needs of everyone up front than it is to come back and do it on the back side. If you're not planning for how to meet the needs of every learner, from that who has the most severe disability to that student who is gifted, if you're not planning for that on the front side, then it will always be an afterthought. If it's an afterthought in your planning, it's an afterthought in your implementation as well, which means it's an afterthought in their learning. So what we're trying to do within the district as an instructional council, working with Dr. Wood, is to really move our thought process and our mindset to what is it I need to teach, and am I making sure that every single learner I encounter can engage and learn from the way I'm teaching this. And that's called universal design for learning. Universal design for learning is also one of the items mentioned specifically in that new monitoring system for special education. And then the last thing on the list is developing the master schedule for every one of our campuses, beginning with special populations as the foundation. You have to start a master schedule looking at special education, Section 504, dyslexia, bilingual dual language, and meeting those needs, and then building the general education master schedule on top of that. That's really the only way you can ensure that the staff we have can meet the needs of students, because we can make sure that we've clustered them appropriately based on need, and that our staffing is sufficient to meet their needs. Roseanne's going to share with you some feedback that we have from our stakeholders today, and then we can answer questions.
So Brenda and I are always constantly bragging on our special ed teachers, our paraprofessionals, and today we were able to get some feedback from campus administrators, teachers, and instructional council members. So this is just some of the feedback that we did receive today. And one of the questions that was asked of them after we met with them was, please share at least one celebration of the Lvisd special education program. And one of the comments was, we are staffed with some of the best individuals and paraprofessionals and are extremely capable in each of our own fields. So we have various classes, different paraprofessionals work with different students, whether they be working on behavior needs or educational needs, so they feel that they are extremely capable in that area. Our teachers are genuinely want to do what is best for students. So they are there, they are passionate, they are working with our kiddos. Good co-teach and resource teachers available and willing to work together. So our co-teachers are our pair teachers, where we have a general ed teacher and a special ed teacher, so they feel that they do work together well. Special education teachers think and develop instruction beyond the classroom, making learning relevant for all students. For instance, we do have a chicken coop at the primary school, so that is something that Mr. Dial actually asked the foundation for, and they have, they're going to be raising chickens, and they're going to have our students with primarily autism, are going to be working with these chickens and just caring for them and just showing them how to take care of the chickens. So that's going to be really neat. And our special ed teachers are willing to try new ideas and integrate new strategies based on student needs. So once again, they're very, they work very collaboratively with lots of our related service staff, to include speech therapists, our occupational therapists, and they just integrate all those resources and strategies within their learning. Second question, please share at least one celebration.
No, it's fine. There's more responses.
Oh, there was more responses.
Yeah.
So there's just some more responses there. We are very appreciative to have adequate support in the classroom. We have some strong models of collaboration. Overall, a very adaptable group. Students are improving, parents are happy, and STAR scores are heading in the right direction. Our core special ed admin team is dedicated and invested in our students. So we had lots of great feedback from our groups today. So which of the items in the Lvisd plan do you feel will result in the largest and most immediate impact? So as you can see there, the consensus is developing the master schedule with special population as the foundation. So that is definitely something that they feel that would make the most impact if we were able to schedule and plan that way. The next one is integrating planning to meet the needs of all learners. So that goes hand in hand with our UDL model that we're wanting to also roll out. And the next one is professional development for general education. So just providing professional development for general education teachers, for our special ed teachers, and just showing them how to work with our students. And the second one is strategic planning for special education, and then vertical alignment of special education planning. So that was the order they had chosen in regards to our plan moving forward.
What was the group that was asked this question to kind of prioritize it?
So each of the stakeholder groups that came in today, it was every one of our campus administrators, our instructional council. We had a few parents to come, as well as some teachers. And our assessment staff.
So that was the 36, that's what made up the 36 respondents.
Yes.
Of this group.
There were special ed and general ed teachers,
Everyone was invited.
but they actually,
Only special ed teachers came. Everyone was invited this week.
So when y'all look at these results and you see master's schedule as the most impactful, what are your thoughts about that being the highest?
I think that master scheduling definitely has a huge impact, because if you don't schedule your campus correctly, your people can't get everywhere they need to be. And that's one of the things they're struggling with right now. I know that when I talk to teachers, they say, I just can't be in all the spaces I need to be. Or we've got so many in this one classroom and we need to move them over here, but we don't want to move children's classrooms after the fact. So we've really got to take a look at that. It's interesting that, well, it's not interesting, but strategic planning comes at the very bottom, but the strategic planning is actually going to help us to identify things for PD and move forward in that direction.
So that's why I was kind of asking the question. So I would suspect that the 36 respondents are looking for those quick wins,
Yes.
immediate needs. What am I faced with every day?
Right.
And when you take a different approach or a different, I would almost look at vertical alignment. So as you were kind of going through these, vertical alignment, making sure that
Right.
everything is up and down, you make things flow.
And a lot of that is work on our side. You know what I mean? That we want the teachers' input, definitely, we want them to be a part of it, but really a lot of the grunt work and the heavy lifting, as Dr. Wood would say, lies with administration and campus coordinators and gathering and moving forward with that plan.
it would have been interesting to see where the comments fell with general ed teachers.
I know, and I wish they had come and
I think it would have
participated.
been different.
I think so. And in years past, we've surveyed the campuses individually to get feedback and share with their principals about how they feel about inclusion as a whole on their campus and how they feel about collaboration. It's very interesting to see a special education perspective, a general education perspective, and an administrative perspective, and we may do that again this year, just to share with those campus leaders so they can see what their campuses are feeling individually and how we can move
Well,
forward.
I might be inclined to think that your special ed are looking at the master schedule so they can get everywhere.
Right.
But I would imagine that your, the general ed teachers and the parents might be more appreciative or needing more of the professional development
Correct.
and training.
Correct.
To really be able to work day to day with the
Right.
special population.
Right. Absolutely. Absolutely. Any other questions?
So I think in the report, some of the findings were that there was different models across the 4 different campuses. So I'm curious, is that just because that's where we've kind of fallen into the 4 different campuses? Or is there an overarching model that we just need to make sure that we emphasize structure to and move forward with?
I think if you dig deep into what we're doing as a whole as a district, you'll see that special education is not unique in this situation. When we talk about what we're doing for reading instruction or what we're doing for math instruction or how we're approaching gifted and talented programming, you'll see that each of the campuses has worked kind of as an island or a silo on their own, and we're trying to streamline those processes in everything that we do. So I don't think special education is unique in that respect. We meet twice a month as coordinators, as well as our assessment team separately, so that we can discuss what's going on in implementation. And when it goes back to the campuses, the principals are ultimately responsible for ensuring that IEPs are met and implemented. And so sometimes what we discuss and plan for kind of takes a different direction. So we're going to be talking about that with our campus leaders as well, and really trying to get everyone together and get on the same page about how we're providing instruction.
So this is, I know Dr. Wood has talked many times about this, you know, when you walk in, everything is preparing you all the way up. It's that full alignment all the way from pre-K through 12th grade. So that's kind of what you're talking about here.
Absolutely.
As far as those models are.
Absolutely. And really understanding that some of our students with the most severe disabilities, we have to start conversations with their families when they're 3 and 4 years old about agency support and how to go about getting on the list, so to speak, with those agencies, because there can be a waiting list that's as much as 15 years long to get support for that child. And so when they finish with us, either at 18 when they've completed their credits, or at age 22 when they finish their IEPs, we want to make sure that they have services in place. And then there's another set of students who we know are college-bound or career-bound or military-bound and are really more than capable of doing those things. And we need to make sure that we're teaching them instructionally what they need to know, but also self-advocacy skills. So that's why we start at 3rd grade with having our students in their IEP team meetings and being a part of what's going on, so that we're teaching the whole student, not just the TEKS from their content areas.
What is the, I guess, the implementation and then follow, do we have any measurables or anything, so we're going to be here looking at your pie chart and seeing how it's all broken down and deciding, okay, here's what we're going to kind of attack first, and this is what we're going to, implement. There are some things that are very easy, probably very easy to implement. We get some successful moving forward. They start moving that needle. Are we going to be looking at this on a quarterly basis or monthly? How are we going to show that we're going to implement the report and the feedback that we're receiving from the staff and everybody, making sure that we just didn't do a report.
Right.
We're going to put it on the shelf. We're going to actually make the right changes for our district.
So the master scheduling piece really cannot take place. I mean, we can start training, but we really can't do anything with the master schedule for the current year. That's a January, February, March discussion about how we're planning the master schedule for next school year. What we can start addressing is the professional development and the integrated planning, and that's already a part of our plans. The integrated planning is, so working with Dr. Wood through instructional council, working through our strategic plan, our district improvement plans, being a part of those meetings, and making sure that this is taking on an integrated approach. What we don't need to do is have special education planning completely separate from what we're doing for everything else within the district. So making sure that as we're reviewing our progress towards our plans for general education, for GT, for bilingual, that we're reviewing our progress in special ed as well. So Dr. Wood and I have talked about these plans and setting some timeframes for things that we want to move forward. We already have a plan for instructional council for universal design for learning. So just making sure that those are on the forefront of our conversations and we're setting some timeframes as we move forward. I don't want us to build in some timeframes and say this is what we're going to do without stakeholder input. And so making sure that we're working with our campus coordinators, with our parent groups, and really trying to incorporate that feedback from them and build that plan out.
Thank you.
Yes, ma'am.
I have a question for Dr. Walker. So are there templates or best practices provided to support the findings in the report? So what if we address one of the findings, how do we know we are performing at the best of our abilities now versus changing some things around? So the paperwork for one of them, how do we know that the changes we made to the paperwork requirement are actually helping us now versus if you came back 9 months later and it was still an issue?
Sure, and I think Linda touched on it a little bit. I think you're going to have to decide how you're going to measure that. A lot of the data I got from that was very qualitative. Obviously, the quantitative data I got was from the PEANS data from TEA. So you could do a survey. You could do a satisfaction survey. You could do a survey related to, we changed some things this year. How are you satisfied with the changes in paperwork? Yes or no? Pretty simple, pretty easy, down and dirty. It's going to be up to you how you want to, because I heard what you're saying was that how are we going to measure kind of what we're doing? And you're going to have to decide how you want to do that. Do you want to do it by survey? Do you want to do it by stakeholder input and just their observation? Do you want to do it by performance data, which we know STAR doesn't reflect everything? So those qualitative instructional issues with kids with disabilities, how are we going to measure the effective practice? When we go in and look at a classroom, we have a rubric. You may come up with a rubric and do some classroom walks. What percentage of our classrooms, specialized classrooms, are we seeing these things that we know are research-based? There are some things that we've tried to put, I say we, but special ed as a whole across the nation have tried to put some numbers to and some best practices to. And so once you decide, okay, for students with autism, they're in specialized classroom, we're going to train for this verbal behavior instruction and it's going to occur. There are also some things we know about specialized classrooms that are effective practices. Scheduling, structure within the classroom, is everybody assigned specific tasks, how are we collecting data on IEP movement. So when I go in a classroom as a principal, I have a rubric, and did I see this or did I not? And not just a one and done. So then Brenda's going to follow up and she may in another month go in and check that classroom. Did I see this? Did I not? And if over time I'm not seeing, a certain percentage of those best practices, then obviously we have to make the progress we want. If I am, I'm continuing to grow, and I'm seeing an increased percentage of those best practices, then we're making progress. So how you decide you're going to measure your growth is strictly up to you. But there's lots of ways to do it. You can do it with surveys, or you can do it with rubrics.
So we're not providing materials as part of the review study. It's up to us to make the changes.
I mean, I can certainly help with that, but it's really up to you to decide how you want to do it. So we have some stuff, and Brenda and I can talk about that, but what works for you, what I think is appropriate may not be what you want to do as a district. So you have to decide how you're going to collect that data, yes.
We've also talked about making sure that our principals understand when you're looking at a T-test rubric for a teacher, that what you should see in a self-contained classroom for special education is very different than what you would see in the general education classroom, what you would see in a co-teach classroom or a PPCD or early childhood special education classroom looks very different. And there are some specific special education tests, kind of like T-tests with the SE in the beginning rubrics, to help them look for those best practices in that type of instructional setting and support teachers and have conversations along those same routes. When I think about the comments about paperwork, it's hard. It's a hard balance. And what I think one of the biggest things we need to do is build context and understanding why we have the requirement for paperwork. Because what we did 2 years ago, 5 years ago, 10 years ago in special education paperwork is very different than what is required of us now. And so it's hard to wrap your head around why you have to do all this paperwork, and I can't just say because the state says so, but a lot of times it's because the state says so, and we just have to figure out the most efficient way for our teachers to provide that documentation.
Any other questions?
Thank you very much. Now we'll move into public comments. Pursuant to the newly enacted Texas Government Code Section 551.007, the board will hear public comment in every meeting and will allow members of the public to speak on any agenda item posted for consideration by the board at the meeting. The board may limit the amount of time allotted to each speaker in order to allow an opportunity for everyone to speak who wishes to do so and to maintain order and efficiency in this meeting. Anyone wishing to sign up and speak in public comment must do so noted at the start of the meeting. There is a 5-minute limit on the speaking. We have 2 speakers tonight. Mr. Kempery.
Good evening, everyone. I'm sure if all of you guys were here the last time that I came in the board before, but if there was somebody missing, I did bring it back because I had some of the information that I provided to the other board. And I also would like to leave this to some kids that don't have one time to read it. I know some of you were not here when I spoke to the board a couple of months ago, so I'm going to start from the beginning. My name is Miguel Cabe. I live in Silverado Hills, and I'm here to address the issue of the intermediate air conditioning system noise pollution. 2009, the Lvisd school installed its new air conditioning system. Silverado Hills immediately contacted school officials and began talking to them about the noise. Talks went back and forth, and in the end of the school, and at the end, the school said that it did not have enough money in the budget to put a viable sound barrier. So a verbal agreement was made between Dr. Harvey, Mr. Burdick, Mr. Engelke, and the Silverado Hills subdivision. The agreement was that the system would run 6 o'clock in the morning to 6 o'clock in the evening. It would not run the weekends, and it would not run during summer and winter and the whole school holidays. Mr. Engelke was very much on top of it, and he honored this agreement until the day that he left the district. Soon after Mr. Engelke left, we started to have problems with the system being run 24 hours a day, on weekends and on holidays. I spoke with Teresa Watson and the maintenance manager many times at that time, but they would fix it temporarily and allow it to go astray soon after. I spoke with Dr. Moreno many times, and he assured me that the time again that the problem would be taken care of. We are now in a new administration team, so again I started to make the same request, giving our neighborhood peace and quiet with Mr. Deck and Dr. Lvisd. I have spoken with both gentlemen many times, and I also addressed the board a couple of months ago to explain the problem. Mr. Deck and Dr. Lvisd both visited my home after that meeting, and I thought we had opened the door for communication. Mr. Deck emailed me at the beginning of the school year saying that they needed some time, would like to work on Saturdays, and I replied that I understood and passed that information to the neighborhood. So there are times where you guys, we're not forcing you not to use it. However, shortly thereafter, communication was once again lost. The system was not turned off for a neighborhood. This may not sound like a big deal, but any plans to entertain our actor were lost when we woke up to the noise that morning. A couple of weeks ago, we had a 4th of July party at our house, and at the end of the evening, everyone even said, "Great party, Miguel," but don't know how you can put out with that noise. Recently, the system suddenly went up to an 8 o'clock shot. I thought maybe it was temporary. However, it's been going on for weeks now, so I called Mr. Deck to request a meeting last week. Ms. Cowley also attended that meeting, and they both informed me that the system was running until 8 p.m. due to a lease that they have with the local hall clock. They both also said that much money had already been spent on trying to solve the problem and did not understand why I continued to complain. Basically, it ended up with them saying that nothing else would be done. This lease takes away the only time neighborhood and my family have to enjoy outdoors in peace. It's completely unacceptable. It's also important that you know that not one real attempt at solving the problem has been done since the system was built. There are proven methods that were recommended by Rabbi Kitzner Consultants when the original noise survey was conducted on March 2009, and none have been taken into consideration. Please see the conclusion and recommendations that attach sheets 8, 9, and 10 that I will drop off later. It's also important that you know that other problems that, well, the other problem is that the system is out of date. The district has lost most of their employees that once knew how to run the system. Mr. Deck acknowledged that the computerized components of the system are old, difficult to manage. If the school cannot afford to implement a real and proven sound barrier, then I understand. But then it is district obligation to at least come to a full, complete understanding of what the problem is and find a compromise. Again, what we're asking is 6 o'clock shut off, no weekends and no holidays. The problem exists, and it's pure tonal noise pollution. I invite the entire school board, anyone who can come to my house in the evening to experience the noise that I'm talking about. When I talk to you about pure tonal noise, there is no way that you can understand what I'm talking about until you experience it for yourself. Even at the day that Dr. Lvisd and Mr. Deck were at my house, the system was off. They were very confused about how it operated. And then when they finally got it on, they set it in an occupied mode, which is not as loud as a system on unoccupied mode. Okay, going from ha to a ha, it's still very annoying, very annoying. Please, I urge you to get with me and schedule a time when a few of you or all can come to my icon and experience this loud, piercing noise for yourselves. When we establish that day at this meeting, I would like for someone from the maintenance department to be available to put the system in both occupied mode and unoccupied mode so that you can experience most conditions. Not that how the survey was done back in 2009, it was only one compressor running. I've been fighting for this cause for several years. Okay. I only have one more paragraph. I would urge you guys to please read it. I'm going to pass this on so that you know I don't interrupt with your time. I would appreciate if you guys could get back with me as soon as possible. I'll give you some extra copies and you can pass on these lists to whoever has not been here before. Here, all the documents that I've provided before. Thank you.
so I'm going to switch it up a little bit. Good evening, I'm Addie White, and I'm a junior at the high school. I'm here today in support of Dr. Levin. In my personal opinion, the student body has been in disarray since principal appointment. And I'm here in support of Dr. Levin as I did the last time I spoke. Nothing has changed since then. He's been a great leader that we need to be. He has stayed loyal to this community, no matter how bad this community has treated him. From a student's perspective, nothing has been the same since his appointment. He's unable to support every aspect of student activity and support us in all of these activities. But now with all the backlash, nothing is the same, and trust me, it's not going away. We need him to be able to be with us without being harassed and constantly brought down so he cannot do his job to the fullest. He needs to be able to do his job. He has done a wonderful job over the time. He needs to continue to have this opportunity. I want to have faith in what we're going to do. Let this be the time. Let this be the time where we all regain our faith in our community. With that being said, I trust the board that they will make an educated decision on this matter, and they will do what is best for the students. Overall, I believe in this man and the goals he has set for organized here. I hope you do as well. Thank you for your time.
Thank you. It is 6:53, and we're meeting in this closed session pursuant to Texas Government Code, Section 551.071, 551.074, 551.0821, and discussion and consultation with legal counsel regarding and including report from the Department of Family and Protective Services regarding superintendent and consideration of appropriate district action, update regarding the status of Oregon Police Department investigation regarding superintendent and consideration of appropriate district action, appointment and employment evaluation, reassignment, duties, discipline, or dismissal of superintendent and or